All right, so now we're going to talk about the differential diagnosis for ARDS. So, like we mentioned earlier, ARDS is caused by an acute lung injury. So what we need to do is make sure we differentiate that this is truly ARDS due to an acute lung injury and not from a chronic lung disorder. It can also mimic symptoms such as pulmonary effusion and hydrostatic edema due to heart failure or fluid overload. So the following are considered like the hallmark signs of ARDS, and they help to really differentiate it from other diagnoses. The first thing is that the patient will have bilateral infiltrates shown on the chest x-ray that get worse, and this happens very quickly. This is during the acute phase. The patient will be experiencing hypoxemia that is unresponsive to oxygen supplementation. This is really important. Basically what this means is that you'll see either on the arterial blood gas or the SpO2, depending on how bad the injury is. No matter how high you crank up that oxygen, it's not going up. Their oxygen saturation is not going up. This is also going to determine how severe the ARDS is. So for instance, if it's not that severe, you'll probably be using a pulse oximeter. But if it's really bad, you're going to be getting arterial blood gases. This may be helped with PEEP, although it depends on the severity of ARDS. So sometimes the ARDS will improve with increased PEEP, but not always. The patient will not have an elevated left arterial pressure, as this could be a sign of heart failure. And finally, the lung compliance is usually decreased, not always, but most likely.